Most of it is provided by LMH Health. Allison Coons gets a wonderful lineup for us of professionals that can help us understand things that come up in our lives at this age. And tonight, she's got someone who's going to get ready, everybody, tell us how to understand our lab results, which would be helpful since most of us don't speak blood work. At least I don't. So welcome everyone to tonight's presentation. And as always, we thank Capital Federal for making our retroactive events possible, as well as Sharon and David Katzman, who through a grant provide our money to keep the lights burning and the retroactive information flowing. We're going to use the chat box tonight, and our presenter asks you to, if you have a question as she's going along, to put it in the chat box, and we'll remind her of it. We'll get that to her when that happens. And she'll also take plenty of questions at the end. So I'm ready if you are. Let's go ahead and Allison, if you would introduce our speaker, we'll get the party started. Thank you so much for being here, everyone, including Allison and Holly.
Thank you so much. And truly thank you to Lawrence Public Library for partnering and being such a great partner as we go through Grey Anatomy. We will be doing this, as Laurel said, once a month. So we're really excited to be able to bring you this presentation and just to let you know a little bit about what's happening at the hospital. So we do have coming up on Saturday, October 4th, we have a Saturday mammography event. So just letting people know that that's an available time on that weekend, and all of that information is on our website. We also have an experience at the farmers market. So we will be at the farmers market on October 18th. You can come to our booth and ask us questions. There's screenings. There's a lot of information. So if you are down that way, please come and say hello. And then also in October, we have a breast cancer panel who is speaking at the library. And that one is going to be in person on October 20th. All of the information about that event, our presenters for the panel, that's on our website at lmh.org. So just wanted to let you know a few things that are also happening at the hospital. And with that, I am going to go ahead and turn it over to Holly Hamilton, who is the director of LMH Health Lab. So welcome, Holly.
Thank you, Allison and library. Thanks for having me. I'm excited to be here. I am going to start sharing my presentation, but I welcome any questions along the way. If the team can help me facilitate, if I don't see a question, just pop it in there. I'm glad to answer questions along the way or at the end. So I'll start sharing my screen here. We see in the screen as we talked about, Allison. Great.
Yep, looks great.
The LMH Health screen. So my name is Holly Hamilton. The initials behind my name stand for Medical Laboratory Scientist, and that's just my accrediting. My registry is through the American Society of Clinical Pathology. I do have that bachelor's degree from the University of Iowa, and I also have a master's in organizational leadership from Baker University. So I am the administrative director of the lab. I am not the medical director. We do have a medical director who is an MD that oversees our lab. So I'm more responsible for personnel, finances, the administrative part of the lab. So that's who I am in my background. I'm going to tell you a little bit today about the lab, what we do, and what you might see on your lab report, and see if I can help you try to interpret that a little bit more today. So like I said, we'll introduce the professional staff in the lab and what we do in the lab here at LMH and in most laboratories. We'll explain the type of lab results that you might commonly see and what the flags or the normal ranges you might see on some of your results, what those mean. And we'll look at some examples of lab results, and then we'll take questions along the way. So does that sound good?
Sounds great.
All right. So most of the staff at LMH that do the testing do have 4-year college degrees or Bachelor of Science in medical lab science or clinical lab science. The kind of the older terminology for that is med techs. So the med techs that we have in the laboratory are, we commonly refer to them now as medical laboratory scientists or medical lab technician, if they have a 2-year or a 4-year degree. We also have phlebotomists in the lab. They're a really important member of our team because most of the testing we do is on blood. And so a phlebotomist helps us collect those blood specimens as well. And most of our phlebotomists have either had a class for phlebotomy or had some on-the-job training or experience. And then there's a couple of other professionals in the lab that we won't really touch on today, but there are histology technologists and our cytology technologists. Those two professionals are primarily in our anatomic pathology lab, and they deal with more tissue specimens with our pathologists. And that, if there's an interest in a separate session on that type of the lab, we can maybe follow up with that later if there's interest in that. But today I'll be focusing mostly on the clinical lab, talking about blood specimens results, urine specimen results, and maybe some cultures as well. So that'll be the focus. Like I said, I'm really excited to be here today. The lab is kind of a hidden in the background part of healthcare, and it is important to know that about 70% of medical decisions are based on laboratory results. So we feel like it's a really important part of healthcare, and love to share a little bit more with you about what we do in the lab. So this is just a screenshot of some of the top tests that we perform at LMH in our lab, and these are pretty common lab tests in general. So I just wanted to give you some terminology today. We'll talk about some CBC results, which are complete blood count. We'll talk some about chemistry tests, which are like a comprehensive panel maybe. Urinalysis is another common type of lab result. And then we'll touch a little bit about microbiology and blood bank results, but not quite as much on those. Just to kind of give you a breadth of testing that we do in the LMH lab. We perform about 300 different tests in the LMH lab for inpatients, for outpatients, for our emergency room to patients. So a lot of patients in the community, if they come to LMH as a hospital patient or maybe as an outpatient, we do their testing here. But there are thousands of lab tests that do exist that we don't perform here at LMH. If we don't do a test here, we work closely with the reference lab and we'll send the test to them to do. But some of those outside, what we call outside results from the reference lab, do end up in your medical record as well. So that's just good to know. Usually it will always say in a lab report where the testing was performed. So that's kind of an important piece to look at when you do get your results back, to know where the test was performed, because that can make a big difference as well. And then I just also have on this slide just some of our, I thought it would just be an interesting fun fact of the volume of tests that we perform in LMH. These numbers I think were from June and July averages. So we, perform about over 6,800 CBC tests a month in our lab. So we're a pretty busy lab. CBC is one of the more common tests that you'll see on any kind of lab result for most patients as well. Questions about that? Good so far?
Okay.
Okay. And this slide has a lot of words on it. It has a lot of kind of high-tech words. Some of them you might recognize, but just wanted to give an example of kind of the categories of tests that you might see on your lab report. You might see chemistry or hematology, that urinalysis, or other areas of the lab. You might see different sections of your lab report that have those kind of categories of tests in them. So those are just kind of the categories or areas of testing that are pretty common for most labs. So this slide kind of just shows you how result flags are going to be super important to check. Every lab can be different. Some of the result flags are colored. Some of them will have different symbols. And I've included several different screenshots of records. Some of these came from my telephone app, my health app that I have on my phone, my personal phone. Some of them are screenshots from a hospital record. Some of them are my results. And then some of them are from, it could look like a paper result as well. So hopefully if you have access to your lab results, you're getting those through a portal or a login to an electronic chart, or you're getting a printed copy of those lab results. And whether you are looking at them on paper or on your phone or on a computer screen, they should all have flags on them that indicate if the value is normal, high or low. So this was an example of a glucose result that did have a high value on it. It was flagged in orange and it had that little high flag on it as well. I'll go through a few different looks of what records might look like. This is an example of a CBC result, and that is a hematology test. You'll see the little category there for hematology. In this specific example, there's lots of colors for those numbers. And this is just an LMH record. The black colored numbers are normal values in this situation. The lows are in blue and the highs are in red. And that might be different for every lab, but this is one example of how they look at LMH in the electronic record. And then in most cases, you'll see a number and it'll have it'll have the number, for example, that WBC count that was done on 10/17 has a number of 28.4. And so that's the number of WBCs that were counted. And then the little letters after that, the K per UL is a unit of measure. So that's just the unit of measure that was detected. Some of the other units of measure for like the hemoglobin, that 11.9 is grams per deciliter. So you'll often see a number, you'll see a unit of measure, and then you'll see a flag after that in those parentheses. So yeah, I'll just show you a few more examples maybe of results. This is just, if you hear somebody talk about your CBC differential, we look at some of the cells under a microscope, and these are just examples of what some of the cells happen to look like. The next screen I'll show you, we count 100 cells when we do a manual count under a microscope, but we actually have instruments that count 10,000 cells, and they also give a percentage of cells that they see. So this is just what we call the differential, the cell count part of a CBC. We've counted all the different cell types, those neutrophils. We saw 72% neutrophil count. So those are just another type of cell that you might see on your CBC count. And just like before, you'll see different colors that'll indicate normal. The black numbers are normal values. The lows are in blue and the highs are in red in this example. And we'll get into reference ranges in just a little bit further in the presentation as well. That'll kind of tell you what would my level have had to be normal, to not be high or low. And I'll show you some reference ranges in a few more slides here. This is an example of a chemistry panel, a comprehensive metabolic panel. So you'll see values just like before. Some of them are sodium, creatinine, all sorts of kind of chemistry names. And you can tell by looking at these, you see a number value, you see a unit of measure, and then you see some flags. I've kind of highlighted just the little section of the report that were high flags. The glucose level was high, the BUN was high. BUN stands for blood urea nitrogen. And then the creatinine is also high level. I do want to kind of advise people that Google can be your friend. It can also be not your friend when it comes to lab results. So I think it's okay to, in my opinion, to ask Google maybe what does a creatinine level tell you in general? And it can give you the basic kind of background of what some of these test names might mean. For example, the BUN and creatinine are kidney function tests. So that's okay to Google, but I would discourage anybody from Googling, what if my BUN is 62? What does that mean? Because it's going to mean something different for every person. Lab results are very individual, and I'll tell you later kind of how to use those interpretations the safest way when you're looking at results. Let's see what else here. This is an example of a urinalysis, a urine test. This one you'll notice it doesn't have quite as many numbers. Some of the values are negative or positive, slightly cloudy, kind of what the urine looked like we're documenting. That blood in the UA, we saw a small amount per milligrams per deciliter, and you'll see the little A flag out to the right side. That is the flag that LMH uses for abnormal. So just like before, the results that are in black are normal, and the ones that are a different color, looks like kind of a red purple color to me, were considered abnormal in that result value. This is an example of a result that looks a little bit different. This is one from my phone, and the numbers are there with the units of measure. And then on the far right-hand side, you'll see some that'll say in range or out of range. So that's just a kind of different kind of flag that's telling you if it's normal, it's in range. If it's out of range, it's kind of an abnormal value on that. So this is an example of those flags are important, and also reference ranges are also important. So with every value somewhere in the chart, you may have to click somewhere different or double click to see the reference range. Reference ranges will tell you how far outside of the norm that is. When you look at that glucose here, it says it's high. If you didn't know the reference range, you wouldn't know that 70 to 100 is the normal range. So 102 is just a tiny bit high. It's just at the upper end of that normal of reference ranges. And also reference ranges, I'll tell you on the next slide here, we'll go back to that one. I'll go back in just a minute. Can be different for every lab. So one lab that has a glucose test, those reference ranges could be different for every lab. And also those reference ranges are usually based on age and sex, generically. So the ranges that I see in my chart are going to be for a female, 53-year-old female. And the reference ranges you see in your chart should be for somebody your age and gender. Now, what the reference ranges don't usually include is anything specific to the patient. The lab's not going to know your medical condition, usually, if you're taking any medications. It's not going to know if you're going through specific treatments. And sometimes patients' normal values can be outside of the normal range, but it could be normal for you. So looking back at that glucose level, it was just barely outside of the normal range of 70 to 100 at 102. But if my glucose always runs 101 or 102, my doctor might say, that's normal for you. So reference ranges and flags are all going to want to take into account the things your doctor knows about your condition and what you clinically are showing as far as a clinical condition. That's why I've got a disclaimer on here that only your doctor, and I'll include your other providers, your APRNs or your PAs, can really interpret the lab report for you, because it could be so different depending on your clinical picture.
Okay.
I'll go back one more, just a few more examples of how results might look in a portal or on a phone app. And I just would always make sure you're kind of looking for flags and you're looking for reference ranges on your results, because those can kind of guide you to maybe ask your doctor questions. Like, I noticed my result flagged high. What can you tell, me more about that? those flags would be something I would, recommend that you do ask your doctor more questions about, your provider. It's kind of a flag to me, is kind of a clue that, you should be asking more questions, or maybe just looking into those values a little bit more. Let's see what else we've got here about that. So those were some hematology results, some urinalysis results, and chemistry results. There's also some kind of higher level of complexity of results that you might have done. For example, if you had a urinalysis test done and we saw some bacteria in there, we might have sent it for a culture. If your doctor suspected maybe you were having symptoms of a urinary tract infection or a bladder infection, they may want that urine cultured. And what that culture does is we usually culture it on media plates. And there's an example there on the left of a media plate. And then if that bacteria does grow, then we can identify the bacteria. And on the lab report, we can say which antibiotics might be helpful for your infection. And that can be true for a urine specimen. It could be true for like a wound, or like if you had another type of infection in your body, even a throat. We can culture that, try to identify the bacteria so they know what kind of antibiotics might be helpful. And then the other type of results that are a higher level are like blood bank results. Blood banking is just kind of its own type of specialized lab testing. And it would take somebody pretty specialized to know what those blood bank results mean. And then the last type of results that I'll talk about would sometimes the pathology results. If you had a biopsy or a surgery, those may not even be released to your chart, because those are really hard to interpret for general people. Unless you're a doctor or a nurse or a PA or a nurse practitioner, it's going to be really hard for those words on a pathology report to make any sense to common people. And I would really discourage you, if you do have access to pathology results, that you not Google the words that you see on those reports. You really want a professional to interpret those results, because there can be some scary words on those results. And sometimes they are scary words, and sometimes they are just words that are in the wrong order that can be misinterpreted. So pathology results are kind of a really highly specialized area of the lab that takes a doctor to interpret. All right, so kind of wrapping up here along the end, our laboratory is staffed with medical laboratory scientists and technicians that do the tests and produce those lab reports. We do provide the results to doctors, so we don't diagnose patients in the lab. But we do have a really important role, we think, in healthcare, in helping collect and provide those samples, performing the test, and putting out those results. Our professional lab staff have degrees, 4-year or 2-year degrees, that help them learn what those lab results mean, how to interpret the results for troubleshooting purposes, to make sure we're always reporting out the highest quality of results that we can. And then our staff do know if they do see results that maybe don't make sense, that they question those. Sometimes we ask for a redraw on a sample. Unfortunately, sometimes samples have to be handled refrigerated or frozen or processed, highly specialized. So every once in a while, we do have to reject a specimen and ask for a repeat blood draw. And that's because we want to make sure those results that we put out are always the highest quality. We never want to put a result out that would mean something for a patient that wasn't truly what their health picture looked like. So that was my formal presentation. I encourage people to email me at any time with questions, or just to follow up with any other questions if you guys have about the presentation or anything else.
Are there any other questions? I'm sure there must be one or two. I had several cross my mind as you were talking, and I know when we go in for, let's say we go in for our yearly visit,
Mm-hmm.
what I call my well baby visit.
Yes.
just to be positive about it. And they normally draw, what test could we expect to be normally drawn from a person in our age group
Yeah,
when
so
we
the
come for a
CBC,
yearly visit?
yeah, those couple of the tests that I showed, that comprehensive panel, the CBC, the urinalysis, and probably a lipid test, probably your cholesterol,
Huh.
is definitely, when they want to check your cholesterol for for cardiovascular risk
Uh-huh.
reasons, of course. But the other tests like that CBC and that comp and even a UA, they're really helpful in just kind of a general wellness.
Uh-huh.
The urine test can tell if you have an infection, but it can also tell how your kidneys are functioning.
Someone, Jack writes, thanks for telling us not to play doctor and try to interpret the results. I would add to that, however, these numbers do change, don't they? I mean, my sister's been tracking her cholesterol for many, many years. It's always been high. And I haven't, now, don't they change? In other words, once upon a time, two something was considered normal, but now we're going down. Is that correct? Don't they change?
Yeah, they can, and I think that's a really good point that either as we learn more about the human, about our health, people are living longer, they are changing those reference ranges. And so I would definitely encourage you to look for a reference range on a result and to ask your doctor questions if you notice something, when those professionals are looking at results, they're looking at dozens and dozens of numbers, and you may see something that they don't. So I would just encourage you to ask the clarifying questions.
Okay.
Um,
Laurel?
And what drives the numbers going down or up? Is it more research? Is it more information? I do know that so many medical treatments seem to be number driven, which makes sense for 55% of the people, 29% of the time get 100%, I mean, I understand how decisions are made, but
Yeah.
what drives those numbers going up and down?
I think it is medical research, and
Okay.
just learning about what makes somebody healthier. And I think some of the drugs companies have also, pharmaceuticals have changed. They have statins that can help lower your cholesterol and
Yeah.
things like that. So lab is closely related to pharmacy sometimes in that way.
Mhm.
Hey, Laurel.
Yes.
Peggy has her hand up and has a question.
Okay.
I can.
Yeah.
There you go.
All right,
you.
thank you. I was kind of surprised to hear you say that the pathology report might not be released to the patient. And I'm a two-time cancer survivor, so alert to the anxiety of waiting for this information. But why would a path report be treated any differently in terms of patient having immediate access to it as it does all the other data?
Right. And I think I may have misspoke a little bit because I think things have changed in response to release of information and patients' rights to have their lab results. So I think current state, most places immediately release all results to the patient because the patient has rights to know their lab results. On the other hand, I think the kind of previous thinking on that was it's kind of scary for people to see results and not know how to interpret them. So I think things are changing and have changed along those lines. And there might be just a slight delay on those results sometimes, just because for pathology example, those tissues have to be processed before they can be, put on slides to be able to read. They have to be, processed, dyed, put on slides and stained in order for them to even look at the slides. So pathology is one area that takes longer in general. And then sometimes the pathologists have to have, either using AI to dictate their reports or they're having somebody help type their reports out as well. So sometimes there's another step in there for pathology. But no, I think that's a great question. And I think things have changed for pathology as well.
Mhm. There
And
is
I would follow up by saying that if the patient reads that, despite the difficulty thereof, that may help prep that patient to ask the appropriate questions, even if you're chewing your nails as you do it. So, it's a start with leveling a bit of the playing field for the patient and doctor.
No, I agree. And I think if you've been a patient who's been through that, you know kind of what you're looking for anyway. Good news, bad news, you know what you're looking for, either way.
There was a comment here. Someone says, thanks for explaining some abbreviations, but why isn't there a glossary attached to our lab results so we can know what, and I'm going to try to pronounce these, eosinophil, basophil, neutrophil, et cetera, mean? Someone says there's
Great.
always Google, but could you help us out here? I don't know.
Yeah. It depends on where you're looking too. I know one of my slides, and it didn't show it super well. I could have done a few more screenshots, that if I had clicked a couple of more times, it would have given me kind of an explanation of the test and what it was used for. So some systems, electronic medical records, have gotten a lot better at being helpful with those abbreviations, and even the terms of explaining what they mean is a possibility. So I think that's great. I think we're always looking to improve our results, and especially now that patients have more access to the results, I think that's a really valid point, that we should be aware that our reports should be more readable for people who aren't medical professionals. They should be more readable for everybody who has access to their chart. I think that's good insight. I'm learning today too.
Okay, good, good. And so you did answer that question, what labs are normally drawn when you go in for your routine physical, the blood panel? And depending upon any pre-existing condition, they might take a look at this or that or the other, but I think the ones you showed us are normally on my report.
Yeah, if you were a diabetic or I did have a high glucose, you might have a hemoglobin A1C. You might have a thyroid test in there somewhere. Maybe if you're a gentleman, you might have a PSA, a prostate test, as well.
Uh-huh. And let me ask about that. I've heard that's always been an interesting number, and I've heard now, well, we all hear an awful lot of things, but I heard now that number is sort of irrelevant. Can you speak to that, or am I asking something a little too?
Are you talking about the prostate test?
Yeah,
the
yeah,
antigen?
yeah,
Yeah.
that jumped
and
into my head.
Yeah, I think that PSA of that prostate specific antigen test is definitely a good example of one that is best used if you've also had an exam. So I think that's a test that's super important, that if you had a doctor who, did a physical exam on you, they would be able to interpret that test a lot better.
Yeah,
Because they need to know some things about your physical, your physical picture to be able to know what the lab result means for you.
right, because as you mentioned, somebody might have this number, and that's their number, and that's
Right.
normal for them.
Right.
But I think prior, boy, anything over 3 or 5, you need to get yourself quickly to someplace and have a biopsy and all that kind of stuff. And so that's changing a little bit.
Yeah, and I think you're right. I think just as the medical community is involved and the medical science has evolved, they've kind of figured out that maybe they need to look at those numbers a little bit different, and that the treatment or, the monitoring of that is a little bit different.
Right. There's a couple questions here. Calc, C-A-L-C, calculated. How is this used is the question.
So, yeah, so some lab results, I know in our lipid panel that we do at LMH, we have calculated values. So we measure the cholesterol, and we'll measure some of the other numbers, the triglycerides, but some of the other values are calculated. And so that just means that, we take the cholesterol and we subtract or divide the triglycerides by it. And some of the values are calculated, they're not measured. So calc usually stands for a calculated value.
And how are they calculated? I mean,
So yeah, a lot of them are, it should show the calculation. A lab will generally show what calculation was used kind of behind the scenes in that reference range.
okay. Another question here is FSH, oops, it moved. FSH is 32.9 and LH is 13.4. What does this mean for a postmenopausal female?
And I would definitely encourage somebody with those numbers to make sure they ask their doctor what that means for
Okay.
them.
Okay.
because based on your age and your medical history, it could mean something different for different people.
Right. Okay.
Yeah. Yeah, and it, they're gonna ask you questions, are you still having a menstrual cycle maybe? And just some other clinical questions that the lab report's not gonna be inclusive of.
Well, no, it just took a sample one day out of nowhere. Here's another question. I heard recently that urine tests are not done regularly during a general checkup now. And why is that?
Yeah.
Age-based only if you have a complaint in that area?
Yeah, so I think that's another example of kind of how pharmacy and lab have interacted. And some of the more recent research has shown that if you're not having any kind of urinary tract symptoms, if you're not having any kind of symptom that's not normal, that a little bit of bacteria in the urine could be normal for people. And if they go ahead and treat that with antibiotics, they've seen some overuse in antibiotics. So
Right.
I think that research has come from the overuse of antibiotics, overprescription of some antibiotics.
Okay. Don't ask, don't tell.
Yeah, if it's not broken, don't fix it.
Yeah, okay. Here's another person, and I think this person might be asking you to be a doctor. My thyroid panel shows normal, but I still have symptoms such as cold hands and feet. What other health issues could cause this?
Yeah, and I definitely think that's another great example of to ask your provider, your nurse,
Right.
if it's not thyroid, what else could it be? And they may have a list of other questions to ask you.
Right. Right.
Your heart rate and some other physical exam, they'll want to do another physical exam, I guess, and maybe a different lab test to kind of go down some roads for symptoms.
Right.
Um,
Any other
Looks like
questions?
there's a question.
Right.
Yeah,
Yeah,
M.
Mike.
Wallace.
is
Go ahead,
my
Mike.
microphone working? Can you hear me there?
Yes,
Okay.
we can hear you.
In teaching business classes, I teach it doesn't do you any good to use metrics you don't understand. And one of the things I know I've worked with my doctor on is explaining to me what these things mean. So at first, you get the list with the numbers on it. It didn't mean jack, cholesterol 12,852. So what? But then she started putting the range on there, like you were showing. But one other thing she's added in is a multi-year trend. So that she can show me these things are happening and this is happening. And, if something's, if it's moving, especially if it's normal, but it's moving in the wrong direction, we can catch it earlier than if we do. So, I use the LMH panels that are on the patient portal on there. And that seems to be a big help also. And then also with what Peggy said, I got a pathology report one time on my cancer, and I asked my surgeon about it, and he didn't know what it meant. I asked the oncologist about it, and he didn't know what it meant. And I've asked the other surgeon, and he said, "Oh yeah, it means this." But I mean, trying to look it up on Google, even asking experts, I couldn't find anything out about it at all. So yeah, I find these things very confusing, and you would think that there could be some kind of a summary statement or thing that could go with this stuff to explain them a little better. I don't think it'd be hard to add that in.
I agree. I think you made two really good points. I think if I do this presentation again, I could definitely include some trends that you can see if if you're a patient who has a certain number of lab work done every year, even every 5 years, you can see those trends, and they could definitely be important as for your individual health situation. And then I think AI is going to be improve lab reports in the future, because I think we will be able to use a little bit of AI to maybe help interpret what these numbers mean.
That seems scary. I don't know why. But it is true. They could probably be very helpful.
We'll see in the
Well,
future.
I also think it's your education. I mean, I just came from a doctor's appointment, and I had to tell her 3 times, use real words. I mean, okay, you use this in your stuff and everything, but it doesn't mean anything. What does that mean? Oh, it means left or right. Well, then just say that.
Yeah, medical terminology is kind of its own foreign language sometimes. I agree.
Yeah, very true. Any other questions about how to oh, here's one. This is a joke, but I get it. Is there a reading lab results for dummies book? I'm joking.
Yeah.
There's a
Well,
dummies for everything, but
yeah, and I would just encourage, and I do think, the internet and Google can be your friend, but I also, use a trusted resource such as LMH.org, Mayo, Cleveland Clinic, just some of those internet or nationally known healthcare organizations or American Cancer Society. Don't depend on just social media, but if you find a trusted organization,
mhm.
I would use their information as a starting point.
Other questions from anyone? I really don't know how medical things are. I do know that I had to cancel my yearly appointment, which was February. This is getting off topic possibly, but the first available appointment I could have is in November. So I don't know if anybody else is in that bind. If you cancel, it's really a long wait. But that's off topic,
Yeah,
but
no,
still.
there's definitely a need in the community for more doctors and
Uh-huh.
nurses and medical professionals to be able to give patients more access.
Right, right. Here's another question. Many problems can be caught with these tests. So how often should we have predictive testing? And do we have insurance to pay for it?
Yeah, that's a really great question. I didn't bring up, but some of those tests that I mentioned, the CBC, the COMP, the hemoglobin A1C are considered screening tests. And CMS, or Medicare is commonly known as, does have medical policies. And most insurance companies will have medical policies that say how often you can have these screening tests. Now, most of them also say that if your initial screening test was abnormal, say your cholesterol was high, then you're approved to have additional cholesterol testing, maybe 4 times a year, or more frequently if you do have a diagnosis or lab results that support additional testing.
Mhm.
Yeah, and I can tell you every insurance policy is different. I would definitely encourage you to work with your insurance company or find their website that lists those policies, because they will usually tell you what you can have and how frequently you can have it that they'll cover.
Mhm.
Good question.
Yeah. Anybody else?
So how often should we have them? Annually at the minimum?
I would say whatever your doctor says.
Can't get a doctor.
Yeah, every person's situation is going to be different. If you have a completely normal medical history, your frequency might be different than somebody who's going through a different, medical condition that requires more monitoring. It's very individual.
So we all need to get ourselves to the doctor as soon as possible,
Yes, yeah.
one way or the other.
And some doctors may be able to order your labs before your appointment, so that they already have the information they need before you get there. So that's worth asking as well. Can I get my labs drawn before my visit so that we have all the information we need at the visit?
Yeah. That'd be good.
It's never very popular, but if you really cannot get in to see a doctor because, and I'm fairly new to Lawrence and struggling to find the proper doctors in general, but 6 months off is not unheard of. But you could go to a Quest lab or LabCorp and request tests that you find to be what you perhaps previously had in another setting, just to get some sense of what might change. But and you can also ask for the cash price versus the top drawer price.
Definitely.
And save all the papers.
Yes, there's some reference labs like Quest and Lab One that will let you kind of pick and pay for your own labs. They have a doctor that will order those, kind of under their name for you, but they do allow that. Now at LMH Lab, we do need a doctor's order or the nurse practitioner or PA's order. But we take outpatients without appointments, as long as you have the piece of paper in your hand or the order faxed to us ahead of time or put in electronically.
I will say I live in Kansas City and I still have all my doctoring at LMH, and your lab's one of the best I have ever been to, not only in terms of the talent, but the people and their personalities too. So
Well,
must be a
thank you.
good boss.
We appreciate that. We work really hard. We don't take appointments at our lab, so with everybody being a walk-in, you never know if we're gonna be busy or you're gonna walk right in. But I can tell you Monday morning at 8 AM is our busiest time.
I bet. It's busy in the school too.
Yes.
My mother told me to see the school nurse when I get here. The school nurse is always busy on Monday. Here's a question. My doctor always comments that my LDL is high enough that I don't need to worry about my total cholesterol. Could you comment, be a doctor again on that observation? The person meant their HDL, so I'll read it again.
Yeah.
My doctor always comments that my HDL is high enough that I don't need to worry about total cholesterol. Could you comment on that observation?
The only comment I can make is that I know HDL is the good cholesterol,
The
which
happy one.
does, yeah, the happy good cholesterol, which does play into your total cholesterol. But yeah, your doctor is the best one to interpret what your cardiac risk is based on those results. So not going to comment much further than that. But yeah, the good cholesterol is a good number to have high. You want your HDL to be
Everyone-
high.
Yeah, good. Keep jogging, whoever you are.
Yeah, keep doing what you're doing.
Yeah. Other questions? It is hard to know kind of how to question it because it almost feels like it. When I see my results, I almost feel like I pretty much look, oh, normal, I'm happy to see normal. I almost don't know what we're looking at, but I guess maybe part of the reason that we asked you to talk to us about this is many of the tests, I guess we don't know why they've been ordered or what it is that we're exactly looking for or looking at. Is that individual with every hospital and lab? They have their own way of reporting the results. I mean, it's not a standard thing like an income tax form.
Yeah, a little bit, but some tests are kind of, I mean, the hemoglobin A1C is for diabetes. I mean, some
Right.
tests are made looking for certain things. But some of those general tests like the CBC or the comprehensive panel, they're looking at everything from liver to kidney to heart to, electrolyte function. So they're kind of all the body systems. So not really a specific test for a specific issue.
And that one's almost always ordered, isn't it? I mean,
Yeah.
every time I go
Yeah.
in.
Because it can detect a lot of things in one test. It can look at the kidneys and the liver and the heart and,
Right.
yeah, a lot of different things from just those one test.
Mhm. Other questions? I almost don't know what to ask. I don't know how to ask an intelligent question other than
I think you
experiential.
all asked really good questions. I would say my takeaway would just be know to look for those result flags. And
Yeah.
if they'll look for those reference ranges, you might have to click a couple extra clicks to look for those, but just to be aware and just start as that place to ask your doctor questions about your results.
Mhm. Any more questions from the peanut gallery? Oh, here we have, I went to the LMH portal, found that I can see my own progression in the past yearly test. That's very valuable. Thank you. So,
Good, good. That was my goal for everybody to maybe learn a little tidbit.
yes, kind of see the trends. That is helpful. You bet.
I would add, because of my own experience, that you can have, for example, anemia, which would be the red blood cell count. And that can tell you, obviously, your red blood cell count is low. But other tests that may or may not be included initially might tell you what's missing in your red blood cell count. So you might find that it's due to lack of iron, or you have plenty of iron. And so that gives some guidance as to what kind of anemia you might have. So don't hesitate to ask about a second question. Well, why do we include this measure? Or do these two measures work together? If they're going apart, maybe that's an issue. So
Yeah,
Right.
that's a really
Take the
good
time.
point. Some of those tests, like the CBC, lead to other tests that may or may not need to be done. And at LMH, we keep our blood specimens for about a week. We keep them for a week. And sometimes, depending on the test, individual test, we can add on additional tests to that same blood draw. Now, some tests we can't, it's not good after 1 day or 2 days, but some of them we can add on additional tests too. So it's always good to ask.
Well, that's nice not to have to undergo another blood draw.
Sometimes it works out that way. Sometimes it doesn't, but
Yeah. That's always been a hassle for me. I always like to see a very confident phlebotomist with a really sharp needle. That's always good to see. Let's see, I've got the ability to see lab results over time is great. For instance, platelet counts that are generally normal range, but are higher during hospitalization. So that's
those
true.
trends can be definitely helpful.
Yeah, very true. All right. Have we asked all our questions? We could end a little early and go have a Bloody Mary. Just kidding about that. I think I'm always just kidding. I apologize.
And if this spurs any other questions or, different topics, I'd be glad
Right,
to come back.
right. Well, I want to congratulate everybody and thank everybody for showing up today because, God bless us everyone. Oh, here goes a flying heart. This person totally enjoyed the presentation. We're all doing the best we can. We're all showing up and trying to get there on time and make that happen and see the dentist and stand up straight and all that kind of good stuff and make sure we can walk and all that. And it's not easy. But we thank you for having the tests, and I thank you all for being conscientious human beings that are taking care of yourselves and moving anything you can, any way you can, for as long as you possibly can, because that's what's for dinner at our group in Retroactive. But I appreciate everybody's interest in this. Somebody says, good joke to end on. I don't remember which one. I have a worse one, but you'll have to stay after. And well said, Laurel. It was really valuable. It was very valuable. Thank you so much, because it's good to know we're all in this thing together, and a lot of us don't exactly know what to do with all this information. But thanks for sharing your expertise with us. Lots of thumbs and claps are flying up in the air. So thank you, Holly, and thank you, Allison. It's been very helpful.
Thank you.
And this has been recorded and it'll be on our website in a day or two. So if you want to see it again, if there's something that you missed or something that you want to check out, please be sure to check that out, and we'll have that available in just a day or two. And guess we'll go. We're a little early, but thank you all, everybody, for being here. And we'll see you next month for Gray Anatomy. I wish we had a theme song. Da, 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 da.